When we want to talk about vitamins, it is important to emphasize that we have two types of vitamins: water soluble, and lipid soluble. Lipid soluble vitamins are DECA vitamins, DEKA, and any vitamin other than DECA is water soluble. And today I want to talk about water soluble vitamins. And first of all, I want to start with B1, or vitamin, we call it thiamine vitamin. And better to know that vitamin B, all of them, are some sort of cofactors in making ATP. So when you do need some ATP, you also need B vitamins. Okay, go back to B1 vitamin. Okay, B1 vitamin is useful in 4 reactions. First, we need it in some enzymes, some enzymes that need TLCFN, tender loving care for Nancy. We have 3 enzymes that we need TLCFN, and T is actually thiamine, okay? It's thiamine. And TLCFN is needed in 3 enzymes. First of all, branch chain keto acid dehydrogenase. This is an enzyme for, let's say, this is an enzyme for metabolism of branch chain keto acids. Okay, and if you could remember, we had a genetic disease that this enzyme was deficient, and that disease was MSUD, maple syrup urine disease, that we had increase in the level of valine, leucine, and isoleucine, and mental retardation, and these sort of things. So you can imagine, if you do not have vitamin B1, so this enzyme does not work. So you have some sort of problem in the brain and CNS and everything in an older patient. Not here is not an infant, it's older patient. So this is the first enzyme that we need, thiamine. Second one is pyruvate dehydrogenase enzyme. Pyruvate dehydrogenase is an enzyme that we needed to change pyruvate to acetyl-CoA, as you remember, acetyl-CoA. So after that, pyruvate dehydrogenase, that this acetyl-CoA can goes into Krebs cycle. This acetyl-CoA binds with oxaloacetate and makes citrates and goes into Krebs cycle and making lots and lots of NADH and FADH2, and at the end it will make, when it goes to electron transport chain, it will make many ATPs, okay? Many ATPs. So look, pyruvate dehydrogenase is important to make ATP, to make actually acetyl-CoA, and acetyl-CoA goes and makes lots of ATP. And also, there is another enzyme in Krebs cycle. This is actually Krebs cycle. In this Krebs cycle, we have another enzyme. We call it alpha ketoglutarate dehydrogenase. Okay, alpha ketoglutarate dehydrogenase, which makes NADH, But if you do not have vitamin B1, you don't have alpha ketoglutarate working well. So all of them will, pyruvate dehydrogenase, alpha ketoglutarate dehydrogenase deficiencies not working, not deficiency actually, not working well because you do not have the cofactor. So your ATP will decreases. If your ATP decreases, your heart goes faster because your tissue, all of the tissues of the body are starving to death. So you need more ATP. So heart pumps faster. So too much load on the heart and pumping faster and faster and faster would make CHF, just like the way anemia makes CHF or hyperthyroidism makes CHF. Too much work, too much load on heart, it will end up to CHF, congestive heart failure. So after you see CHF, so you can see if the heart is not pumping blood but receiving blood, so it will be filled with blood, and lots of blood cannot go into blood, and you have vein pooling of blood and increase in hydrostatic pressures, and you will end up in edema. When you see edema, we call it wet berry. Okay, we call it wet berry. And another enzyme that we need for that to work well is transketolase. And what is transketolase? Transketolase is an enzyme which is needed to make some sugar phosphate, intermediary sugar phosphates, that these sugar phosphates are necessary for brain actions, brain work. So if this transketolase is not working well, so you would end up in dementia, some sort of dementia that we call it Wernicke-Korsakoff syndrome or Wernicke-Korsakoff dementia because of transketolase not working well.